I would like to introduce Dr. Hoidekrová from Praga for the talk titled The Application of a Low-Cost Mobile Medical Device for Online and Offline Telerehabilitation of Neurologic and Orthopedic Patients in Massive Clinical Use.
Good morning, everyone. First of all, I would like to apologize to my colleague who finally couldn't come, but I'm really glad that I can be here and share with you our experience. I'm Dr. Kristýna Hoidekrová, and I work in a rehabilitation center Kladruby in the Czech Republic. On the beginning, the background of our research, the aim of our study was to verify the usability of mobile feedback therapeutic system HOMEBALANCE in the group therapy as a substitution of the individual therapy. The second point of our research was to evaluate the effects of this kind of the therapy and also evaluate the effect of the therapeutic time. What did we find out as a necessary to our research? We wanted to use the system with the audiovisual biofeedback, which is based on the gaming, because we know that the game motivates the patient. Also, we want to use the system with the task-oriented exercise with high effectivity of motor learning and also objective evaluation of the patient's performance. We choose HOMEBALANCE, which is a system which was developed by the Faculty of Charles University in the Czech Republic. It is a certificated medical device for therapy for balance. The system has lightweight, is it affordable, and also is it easy to use for the patient in their home environment. In a lower picture, you can see two scenes of the gaming train. HOMEBALANCE consists of a classical V balance board, which is wireless connected with the PC, whereas the specific training program. In lower picture, you can see that the V board balance, is it possible to use it in different positions. You can use it in a standing, in a sitting, but also you can use it for a training of the upper extremity. The specific balance training, patient during this training can use different kind of strategy to maintain the balance, and also they activate the deep core stability muscles. What do we focus on? Limits of stability, accuracy of movement, mediolateral symmetry, and reaction time. Our group, we included 319 patients, 199 female. The average age was 54, with the standard deviation 12.9. The patient with the orthopedic and neurological diseases who were hospitalized in our rehabilitation center. Our patients receive conventional individual therapy, one patient to one therapist for 4 times per week, and 1 a week they receive group balance therapy with the HOMEBALANCE under the supervision of physiotherapists in ratio 1 therapist to 7 patients. The whole program took for 3 to 6 weeks, and this balance group therapy consisted of testing and references exercises using HOMEBALANCE for 3 minutes, then therapy with the HOMEBALANCE for 5 minutes, and then the independent exercise for 15 minutes. Improvement of our patient after the 3 to 6 weeks. On the left picture, you can see the improvement in the time. That means that patient managed the reference scene faster than before the therapy. On the right picture, you can see the length of the trajectory. That means that the patient managed the reference scene in better accuracy than before the therapy. The results is that the design of the study was accepted without the accuracy of any undesirable side effects. The average improvement in the scoring in the therapeutic time was by the 11 seconds on a p-level 0.002, and the study demonstrated a statistically significant shortening of the trajectory of the project of the center of the gravity in the dynamic referential scene after the series of the therapy on a p-level 0.004. what is our vision, what we are going on now actually. We focus on to detection of fatigue and optimalization, the difficulty. We also monitoring the physiological function and other parameters. And because of the poor evidence-based practice and evidence-based about the telerehabilitation in Czech, we also focus on to analyze the data and we try to use the virtual therapists. We also connected telerehabilitation with the distance therapy. For us, the distance therapy means the asynchronous offline telerehabilitation. We use remote therapy settings in the clients. From this system, data are online transferred to the supervision, to the diagnostic from therapists, and then the therapist can contact via Skype or classical phone call the patient in his own environment. I hope that this year we start with the multicenter rehabilitation study, which is included 5 or 4 our rehab center. And intervention which will be included to the study is physiotherapy with using the HOMEBALANCE, psychological intervention with using the REHACOM system, occupational therapy with the leap motion, smart cube, and also in area of occupational therapy, we would like to assess the quality of the life in a home environment after the stroke, and of course that we would like to telemonitoring via accelerometer, and also we focus on the diabetes mellitus, blood pressure, and so on. Our conclusion, in a study of 319 patients, it was demonstrated that the system can be used by patients independently without any disability side effects and can further be included to home-based distance therapy. The second point of our conclusion was to using distance therapy for the recommended duration for 20 minutes a day for 8 weeks would reduce staff costs by 8 hours and extend the length of the treatment by 117% in outpatient settings. Thank you for your attention.
Thank you to Dr. Hoidekrová. Any questions? There, the microphone.
Hi, I'm Sabrina from Malaysia. I'm very impressed. How do you monitor fatigue again? I didn't catch that. You said you wanted to measure fatigue.
Fatigue, actually, we have some questionnaire nowadays for the patient, and we will see if we use another device or assessment tools. But now we will assess by some questionnaire.
So it's a subjective, self-perceived fatigue. Mm-hmm. Is there scoring for it? Outcome measure? Actually,
this one, it's study which will be, so it's still in a process. Yeah. So okay. We still discuss about it.
But I think it's very, very useful for the end user. And the second question is, okay, so this is all about study. How do you roll it out so that the end user can be used by anyone, not only in your country? Do you plan to expand it to other countries other than yours?
You mean to use the HOMEBALANCE?
Yeah.
Yeah. We would like to spread it. Actually, it's very successful and for our patient. And usually after the finish the study, some of them also buy it and they continue in a training with HOMEBALANCE in their home environment also after the finish of the study. So definitely we plan to spread it also to another area.
So the bottom line is, how much does it cost in
euro? In euro, it's 2,500.
Okay, so how are you going to make it available for low-income, low-resource countries? How is it? It's too expensive for low-income countries. Do you have any solutions for that?
Actually, that's not my part. I'm not the manager of this project in this area, but for the Czech, it is a local system. So for our country, it is possible also for the big group of the patient to buy it, but also we can think about what you asked.
There is another question.
I was the question is about like this system. You make like assessment. Your system have the initial assessment, or you make some correlation with other scales to make like a correlation about the balance system, like how you manage. Like
The system is more for the therapeutic than the diagnostic. But the diagnostic part we also compared, for example, with the study with posturography, and the results was very similar. So we, in diagnostic part, we compared, for example, with the results of posturograph.
okay.
Thank you very much.